Podcast 8 of the Upper Limb series, the Posterior Forearm. This podcast is going to complete the study of the forearm by detailing its posterior compartment. So the posterior compartment of the forearm contains a series of muscles that are involved in extension and abduction of the hand and fingers, along with supination of the forearm. Because of this range of movements, the posterior compartment is also referred to as the extensor supinator compartment. The muscles in this compartment are posterior to the radius and ulna and are separated from the anterior compartment by the interosseous membrane that runs between these two forearm bones. There are 11 muscles in the posterior extensor supinator compartment that, like the anterior compartment, can be divided into layers. In this compartment there's two layers, a superficial and a deep. So let's turn to the muscles that make up the superficial layer. And there are 6 muscles in this layer, and these are brachioradialis, extensor carpi radialis longus and brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. So let's detail these muscles individually. Brachioradialis lies superficially on the anterolateral aspect of the forearm and is sometimes thought to be part of the anterior compartment because of this positioning. But because it shares its nerve supply with the other extensor muscles, it is convenient to describe it as part of the posterior group. It originates from the lateral supraepicondylar ridge of the humerus and extends superficially to the distal end of the radius, but it doesn't attach to the radius's styloid process. As it extends to the radius, it forms the lateral border of the cubital fossa and forms a partition between the flexor compartment and the extensor compartment. You can easily observe brachioradialis by flexing the elbow against resistance with the forearm in the mid-pronated position. You should be able to notice a bulge on the anterolateral surface of the forearm, which you should be able to palpate. This movement indicates that brachioradialis is involved in flexion of the forearm at the elbow joint, and the movement is maximal when the forearm is in the mid-pronated position. So moving medially within this superficial layer, so that's towards the ulnar side, there are 2 extensor carpi radialis muscles, extensor carpi radialis longus and extensor carpi radialis brevis. The longus version sits directly under brachioradialis and also extends from the lateral supraepicondylar ridge to the base of the second metacarpal. Extensor carpi radialis brevis is deep to longus and extends from the lateral epicondyle of the humerus to the base of the third metacarpal. So longus attaches to the second metacarpal and brevis attaches to the third metacarpal. Both of these muscles are responsible for extending and abducting the hand at the wrist joint. The lateral epicondyle of the humerus, which as I just mentioned is the origin of extensor carpi radialis brevis, is an important landmark for the posterior compartment as it is the common extensor origin for several of the muscles in this compartment. So along with extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris also originate from this bony landmark. Extensor digitorum forms the bulk of the musculature in the posterior compartment and gives off 4 tendons that attach to the medial 4 fingers. It does this by these tendons flattening to form the extensor expansions, which is an aponeurotic sheath that wraps around the dorsum of the metacarpal heads and proximal phalanges. I'll consider the extensor expansions in more detail in podcast 10 when I detail the muscles of the hand. Also coming from the common extensor origin is extensor digiti minimi. This muscle extends to the extensor expansion that's associated with the 5th digit. Contraction of both extensor digiti minimi and extensor digitorum will extend the fingers, initially at the metacarpophalangeal joint, and then with continued contraction at the interphalangeal joint, and they can also extend the hand at the wrist joint. The final muscle to originate from the common extensor origin is extensor carpi ulnaris. This muscle extends most medially within the posterior compartment and attaches to the base of the fifth metacarpal. Like the extensor carpi radialis muscles, extensor carpi ulnaris extends the hand at the wrist joint, and due to its medial location can also adduct the hand. All of these muscles in the superficial layer of the posterior compartment, so that's brachioradialis, extensor carpi radialis longus and brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris, are all supplied by the radial nerve. So now let's turn to the deep muscles of the posterior compartment, and also detail an important space, the anatomical snuff box. So there are 5 muscles that are deep within the posterior compartment, and these are primarily associated with the thumb. The muscles are abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis, and as they have pollicis in their name, are all associated with the thumb. Completing the group is extensor indicis and supinator, which I'll detail towards the end of this podcast. Abductor pollicis longus comes from the proximal halves of the ulnar interosseous membrane and radius, and extends to the base of the first metacarpal. Extensor pollicis brevis comes from the distal third of the radius and the interosseous membrane, and extends to the base of the proximal phalanx of the thumb. Extensor pollicis longus originates from the middle third of the ulnar and interosseous membrane, and extends to the base of the distal phalanx of the thumb. As it passes to the proximal phalanx, it runs medially alongside the tubercle of the distal radius, and this changes its line of pull, and it forms an important space between the long tendons of the thumb, and this space is the anatomical snuff box. So the 3 tendons that go towards the thumb form a space, and you can observe this space by extending your thumb, which tightens these tendons so they are visible under the skin, and this creates a triangular shaped hollow at the base of the thumb. The anatomical snuff box is therefore bounded by these 3 long tendons as they pass from the posterior compartment to the thumb. So most anteriorly, the anatomical snuff box is bounded by extensor pollicis brevis and abductor pollicis longus. Posteriorly, it is bounded by extensor pollicis longus. You should also be aware that it has a floor, and this is formed by the scaphoid and trapezium bones, and palpation of this space reveals the radial artery. The anatomical snuff box is an important landmark to recognise clinically, as tenderness in this space can indicate a fracture of the scaphoid bone. So an easy way to remember the order of the muscles at the anatomical snuff box is to remember what movements they cause, which from medial to lateral, remember we are on the posterior surface, so medial to lateral is still from the little finger to the thumb. The movements of these muscles are extension, extension, abduction. After extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. Now if you add the length of the muscles, so again from medial to lateral, you have longus, brevis, longus. If you now put these together, from medial to lateral on the posterior surface of the forearm, you have extensor, extensor, abductor, and longus, brevis, longus. Therefore you have extensor longus, extensor brevis, and abductor longus. They all act on the thumb, so if you add pollicis, you have the muscles of the extensor compartment that act on the thumb and the order in which they form the anatomical snuff box. Extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. To finish the podcast, I just want to detail the final 2 muscles in the deep layer of the posterior compartment. These are extensor indicis and supinator. Extensor indicis extends to the extensor expansion of the second digit from the distal third of the ulnar and interosseous membrane, and is involved in the extension of the second digit, independent of extensor digitorum. And finally, supinator. As its name suggests, it is involved in supination of the forearm. This is a short muscle that has 2 heads, a superficial head which originates from the lateral epicondyle, and a deep head which originates from the supinator crest of the ulna. Both of these heads converge and attach the lateral surface of the proximal radius. As the ulna is fixed within the forearm, contraction of supinator allows the radial head to rotate against the capitulum of the humerus, and this movement moves the distal head of the radius to a more lateral position alongside the ulna. Like the superficial layer of muscles, the deep layer of muscles in the posterior compartment are also supplied by the radial nerve. So in this podcast, I've detailed the muscles that make up the superficial and deep layers of the posterior compartment, and also the boundaries and contents of the anatomical snuff box. In the next podcast, number 9, I'll look at the carpal tunnel and the retinaculum of the wrist.